Hello, dear learners. I welcome you all to another video session of the MOOC titled Rural Development in India. In this session, we shall discuss the unit which is titled as Rural Health and Nutrition and Overview. Dear learners, we all know that India is predominantly a rural country with nearly two-thirds of its population residing in the villages. Rural health and nutrition are therefore critical determinants of country's overall development. Despite significant economic development, significant economic growth, and advancement in healthcare, rural India continues to face serious challenges related to health infrastructure, disease burden, and malnutrition. In this unit or in this video session, we shall discuss the status of health and nutrition in rural India and also discuss the key issues concerning health and nutrition. What are the causes of, lower health status, or what are the causes of lack of nutrition or nutritional deficit among the rural population, what are its consequences, so on and so forth. So, dear learners, we know that health and nutrition are interlinked concepts. Good nutrition is very, very essential for maintaining health, while poor health can worsen nutritional outcomes. In rural India, this relationship is often negatively reinforced due to poverty, lack of awareness, inadequate health facilities, and existing social inequalities. Despite having a wide range of, flagship nutrition programs in our country, such as the National Food Security Act, Integrated Child Development Services, the PM Poshan Scheme, so on and so forth, undernutrition still continues to persist in the country, thereby, it's persisting and it's lingering from time immemorial, and thereby leaving millions of children and mothers caught in the recurring cycles of hunger and poor health. Now, if we talk about the Global Hunger Index report that has been published in the year 2025, we will see that the condition of, in health and nutrition, the condition of health and nutrition in India is, very, very poor, in the sense that India, the report states that India ranks 102nd out of 123 countries. And this is really an alarming situation, because with a score of 25.8 in the 2025 Global Hunger Index, India has a level of hunger that is very, very serious. Now, this Global Hunger Index score, that is based on the values of four indicators or four major components. That is, 12% of the population in our country is undernourished. Then 32.9% of the children under the age of 5 are stunted. Now, what is stunting? Child stunting means the share of children under the age of 5 who have, lower height for their age, reflecting chronic undernutrition. Then again, 18.7% of children under 5 are wasted. Now, what is this wasting? It implies the share of children under the 5 years of age who have lower weight for their height. And this reflects the case of acute undernutrition. Then 2.8% of children in the country or in India, die before their 5th birthday. So taking all these into account, we see that India has a ZHI score of 25.8 and its rank is 102 out of the 123 countries that have been evaluated. So the condition of hunger, malnutrition, undernourishment is very, very serious and alarming in our country. And these issues are particularly severe in the rural areas, especially among the vulnerable groups of population. According to various national surveys and studies, malnutrition, anemia, and preventable diseases remain widespread in the rural regions. For example, a significant portion or a significant proportion of children suffer from stunting and underweight conditions, while women face higher levels of anemia. These issues highlight the urgency of addressing rural health and nutrition in a comprehensive manner. Now, if we take into account the data from the National Family and Health Survey 5, that is NFHS 5, approximately 35.5% of the children under the age of 5 are stunted, which reflects chronic malnutrition, thereby affecting their growth, and 19.3% are wasted, again, which suggests acute malnutrition leading to low weight in considering their height, and 32.1% are underweight. And as we have already mentioned, that vulnerable groups, especially the vulnerable groups like the scheduled tribes, face higher levels of malnutrition with stunting exceeding 40%. So the situation is very, very critical. And there are a number of issues, pertaining to concerning rural health and nutrition in India. So these data, these surveys, these reports, give us current health status and nutritional status of our country. And this shows that, rural India as a whole, is still ridden with lower health outcomes, undernourishment, malnutrition, issues of anemia, and other poor health conditions. So rural India even today faces a double burden of communicable and non-communicable diseases. Infectious diseases such as tuberculosis, malaria, and diarrhea remains prevalent due to poor sanitation and limited healthcare access. Again, at the same time, non-communicable diseases like diabetes and hypertension are also increasing. So, in terms of health, if you see, there are both prevalence of, communicable as well as non-communicable disease in the rural areas, and health infrastructure in the rural areas are often inadequate. We'll discuss these issues in details, but then you see that if we see near our localities or nearby rural areas, we'll find that the primary health centers, the sub centers that are there, they often suffer from shortage of doctors, medicines, and equipments. Many villages even lack access to emergency medical services. So this is the overall situation of or overall health status in rural areas in our country. And a nutritional status, as we have already mentioned, that even today the rural areas, the vulnerable groups suffer from malnutrition, then dietary deficiencies, so on and so forth. And this malnutrition is one of the most serious challenges in rural India. And we can make this out from the higher levels of child stunting, the widespread anemia among children and women, so on and so forth. So all of these gives us a very gloomy picture regarding the nutritional status of rural areas in the country. And additionally, there is also a growing concern of double burden of malnutrition, where undernutrition coexists with obesity and lifestyle diseases on the other hand. We have been having malnutrition. The rural population have been suffering from undernourishment, malnutrition, so on and so forth. And now, there is again, a growing or increasing problem of obesity and other lifestyle diseases in the rural areas too. So, dear learners, this gives us an overview of rural health and nutrition in the rural areas. Now, let us try to discuss in details what are the major issues and concerns regarding rural health and nutrition. The first one is malnutrition and undernutrition. As we have mentioned before, malnutrition remains a persistent issue particularly among children, pregnant women, and lactating mothers. It includes protein energy malnutrition, micronutrient deficiencies, for example, iron, iodine, vitamin A, etc. Then hidden hunger, that is, a lack of essential nutrients despite adequate calories. Then there is poor health infrastructure, which is another major concern in the rural areas. And we see that rural health infrastructures or facilities often lack qualified doctors and specialists, diagnostic equipments, adequate medicines, so on and so forth, which leads to delayed treatment and reliance on unqualified practitioners. Then another major concern is high out-of-pocket expenditure, which implies that, almost nearly 70% of the healthcare expenses in rural India are borne by the households, thereby pushing millions into poverty each year. Since, we do not have a proper functioning of government hospitals in the rural areas or government PHEs, there are lack of doctors, there are lack of diagnostic equipments, there are lack of medicines. So rural households are compelled to move to nearby towns and cities and get admitted in private hospitals or take appointments in private clinics for their treatment, and thereby they are pushed into poverty. Many times they even have to sell off their land to meet the medical expenses. They have to borrow and are indebted while trying to save their family members from diseases, so on and so forth. So there is a huge household expenditure in terms of availing health facilities or healthcare. Then another major concern is the maternal and child health issues that is persistent in the rural areas. Even today, there are high maternal mortality rates, low birth weight babies, inadequate antenatal and postnatal care, so on and so forth. So, this is also another very crucial issue in terms of health and nutrition. Then, lack of dietary diversity is another major challenge in the rural areas. And even when food is available, diets are often cereal based and they lack proteins, fruits and vegetables, micronutrients, so on and so forth. Though people, consume, it is only to mitigate or it is only to settle their hunger, but many a times they remain undernourished because they do not take or they are not able to take or they cannot afford nutrient rich diet. So many people in the rural areas, they consume sufficient calories but still they remain undernourished because of the lack of nutrients in their intake. Then poor water, sanitation and hygiene is another issue of grave concern in the rural areas, because even today we see that in many rural areas drinking water is not safe, and there is open defecation, then there are poor hygiene practices in many rural areas, and all of these contribute to infections like diarrhea and which reduce nutrient absorption. So because of poor water, sanitation and hygiene, there are more, the rural population are more prone to diseases and infections. Then another issue is the gender inequality in the rural areas. We know that women have been facing or rather historically facing gender inequality in our society, and we often see that women are the ones who eat the last and receive the less nutritious food. They also face barriers in accessing healthcare, thereby leading to poor maternal and child health outcomes. And lastly, another major area of concern pertaining to rural health and nutrition is the inadequate implementation of government schemes. Although there are several government programs and schemes pertaining to, improving rural health infrastructure, providing health facilities to the rural population, providing nutritional benefits to the rural population. But then issues such as corruption, leakages, and poor monitoring reduce effectiveness and, actual, functioning of these schemes and policies. And we often see that the people in the rural areas do not receive the benefits that actually they were supposed to or that were intended in the policies. So these are the major issues, dear learners, concerning rural health and nutrition in the rural areas. Let us now try to understand the causes of poor health and nutrition in the rural areas. One of the most fundamental causes of poor health and nutrition in rural India is widespread poverty and low income levels. We have been discussing in our previous modules that, since agriculture, large proportion of the rural households depend on agriculture, which is often seasonal, uncertain, and vulnerable to climatic variations. Therefore, income from agriculture highly remains unstable and also insufficient to meet the basic needs of majority of the rural households. Now, when resources are limited, when income is uncertain and mere, then, families tend to often prioritize, filling their stomachs over ensuring balanced diet. Their only priority is to somehow settle their hunger, somehow fill their stomach, rather than making nutritious food or purchasing items that would give you nutrition. No, they cannot afford to do so. So they only are concerned about eating whatever is required to fill their stomach, and the balanced diet or nutritious diet is a far cry for majority of the rural families. And this leads to reliance on cheap, calorie dense but nutrient poor foods such as cereals, while essential components like proteins, fruits, and vegetables are often neglected. Poverty also restricts access to healthcare services, medicines, preventive care, so on and so forth, thereby aggravating health issues. Then another significant cause is the lack of awareness and education regarding nutrition and health practices. Many people in the rural areas are unaware of what constitutes a balanced diet or the importance of micronutrients such as iron and vitamins. Traditional beliefs and food taboos also, worsen the situation, particularly for pregnant women and children. For example, certain nutritious foods are avoided or may be avoided due to cultural misconceptions. And all of this contributes to worsening of health outcomes. In addition, limited knowledge about hygiene, sanitation, breastfeeding practices, and childcare contributes to poor health outcomes among the rural population. Thirdly, the inadequate healthcare infrastructure that we have been discussing about is in the rural areas is a major contributing factor for lower health causes of poor health and nutrition in rural areas. Although government facilities like primary health centers and sub-centers exist, they often suffer from, as we have already stated, trained doctors, nurses, medical equipments, diagnostic equipments, medicines, so on and so forth. And many villages are located far off from the health facilities, thereby making access to these health centers very, very difficult, especially in terms of emergencies. Transportation challenges further delay treatments. And due to all these limitations, rural population often rely on unqualified practitioners, which can lead to improper diagnosis and treatment, thereby worsening their health conditions. Then the fourth factor is, of a very critical one, but is often overlooked. That is the lack of dietary diversity in the rural diets. As we have already discussed it, many rural households depend heavily upon staple crops such as rice, wheat, etc., which provide energy. They are only concerned about, somehow settling their hunger, filling their tummies and stomachs, and often, because of their, lower income levels, they are compelled to consume diets which lack the essential nutrients. The consumption of pulses, dairy products, fruits, and vegetables is relatively lower due to affordability issues and limited availability in the rural areas. This results in micronutrient deficiencies among the rural population, which is also known as hidden hunger, where individuals may consume enough calories to fill their stomach, but actually, in reality, they still suffer from malnutrition due to a lack of essential vitamins and minerals. Then again, poor water, sanitation, hygiene conditions also play a crucial role in determining health and nutrition outcomes. And in many rural areas, access to clean drinking water is limited. There is open defecation, which is still practiced despite improvements in sanitation coverage. And all these conditions increase the incidences of waterborne diseases such as diarrhea, cholera, intestinal infections, so on and so forth. And frequent illness reduces the body's ability to absorb nutrients, thereby contributing to malnutrition, especially among the children. Then, as we have already mentioned, gender inequality and social discrimination is another major cause behind poor health outcomes, poor nutrition among the rural population. Gender inequality and discrimination further elevates or further reinforces the problem of poor health issue among the rural population. In many rural households, women and girls are given lower priority in terms of food and health care. They often eat at last and receive the smaller or less nutritious portions. This leads to widespread anemia and undernutrition among women, which in turn affects maternal and child health. Additionally, marginalized groups such as scheduled caste and scheduled tribes often face limited access to resources and services due to social exclusion. Then, another factor which causes or which contributes to poor nutrition in the rural areas is the agriculture and food system structure. Agricultural practices in rural India are largely focused on production of staple crops rather than nutrient-rich foods. Factors such as lack of irrigation, poor soil quality, and limited access to modern farming techniques reduce the diversity and quality of food produced. Climate change, including droughts and floods, further disrupts agricultural productivity and food security. Further, the lower incomes and poverty compels the farmers to use lot of pesticides, lot of chemicals for increasing productivity, and this also negatively affect the health conditions of the population. And lastly, as we have discussed before, the weak implementation of government programs adds to the problem. While there are numerous government schemes which exist to address the health and nutrition issues in the rural, in the overall country's population and the rural population in particular, but there are issues of corruption, lack of monitoring, then administrative inefficiencies, then chiffoning of funds. All of these limit the effectiveness of the policies, and many beneficiaries either do not receive the intended services or receive them in inadequate quantities. And all of these are the major causes behind poor health and nutrition among the rural population. Dear learners, let us now discuss the consequences of poor health and nutrition among the rural population. When we talk about the consequences of poor health and nutrition in rural India, these are far-reaching and affect individuals, communities, and the nation as a whole. One of the most severe impacts is on the child growth and development. Malnourished children often suffer from stunting, wasting, and underweight conditions. These physical impairments are accompanied by delayed cognitive development, reduced learning capacity, and poor academic performance. As a result, children are unable to reach their full potential, which affects their future productivity and quality of life. Poor nutrition also has a serious implication for maternal health. Women who are undernourished are more likely to suffer from anemia, weakness, and complications during pregnancy and childbirth. This increases the risk of maternal mortality. Additionally, undernourished mothers are more likely to give birth to low birth weight babies who are themselves at a higher risk of malnutrition and illness. This creates a vicious cycle of poor health that continues across generations. Another important consequence is the increased burden of diseases. Malnutrition weakens the immune system, thereby making individuals more susceptible to infections such as tuberculosis, respiratory illness, and diarrheal diseases. At the same time, the rise of unhealthy dietary patterns is contributing to non communicable diseases such as diabetes, hypertension, and heart diseases. This dual burden places immense pressure on already weak rural healthcare systems. The economic consequences of poor health and nutrition are also significant. Individuals who are unhealthy or malnourished are also less productive and unable to work efficiently. This reduces household income and perpetuates poverty. Families often spend a large portion of their income on healthcare, leading to financial stress and, in many cases, indebtedness. At the national level, poor health reduces the overall productivity of the workforce, thereby slowing economic growth and development. Poor health and nutrition also contribute to intergenerational cycle of poverty and malnutrition. Children who grow up malnourished are more likely to have limited educational and employment opportunities as adults. When they become parents, they may not have the resources or knowledge to provide adequate nutrition to their children, thereby continuing the cycle. Breaking this cycle is one of the biggest challenges in rural development. Another major consequence is the impact on education and human capital formation. Malnourished children often have low energy levels, poor concentration, and higher absenteeism in schools. This leads to lower academic achievement and higher dropout rates. Over time, this results in a less skilled workforce, which affects the country's long term development prospects. Socially, poor health and nutrition can lead to a reduced quality of life and social inequality. Vulnerable groups such as women, children, and marginalized communities are disproportionately affected, widening the already existing inequalities. Poor health also limits individuals' ability to participate fully in social and economic activities, thereby leading to exclusion and marginalization. Finally, the combined effects of poor health and nutrition places a heavy burden on public health system. Increased demand for medical care combined with limited resources leads to overcrowded facilities and inadequate service delivery. This further reduces the quality of healthcare available to the rural population. So, dear learners, these are the significant or major consequences of poor health and nutrition in the rural areas. The condition of health and nutrition in rural India actually reflects a broader reality of uneven development where improvements coexist with persistent structural challenges. While we have seen number of government interventions and increased awareness, which have led to significant developments or measurable progress in terms of reduction of child mortality, better immunization coverage, and gradual decline in malnutrition, but even today we see that the overall situation in the country remains deeply influenced by poverty, inequality, and limited access to quality healthcare services. Even though there have been a lot of improvements in terms of building healthcare infrastructure, recruiting healthcare staff, and and various schemes for providing health benefits and nutritional diet to the rural population, but these are not uniformly distributed. The schemes, the policies are not effectively implemented, and therefore the marginalized communities, particularly in the remote and the tribal areas, continue to experience deprivation. And therefore there exists a gap. That is the critical issue, that there exists a gap between policy formulation and implementation in the country. Though in India, there the government has designed, the policymakers has designed comprehensive programs such as integrated child development services, Poshan Abhiyan, so on and so forth, which aims to tackle malnutrition and improve maternal and child health. However, there are challenges such as inadequate infrastructure, irregular service delivery, lack of trained personnel, and bureaucratic inefficiencies often reduce the effectiveness of these policies and schemes at the grassroots level. And all of this highlights that there has to be more efficient governance, and there has to be some accountability mechanisms that are devised for the successful implementation of these policies. And another important dimension in terms of rural health and nutrition is the role of the social and cultural factors. Health and nutrition outcomes in India are not merely determined by economic status, but also shaped by gender norms, caste hierarchies, and traditional practices. Women, despite being central to the household, nutrition and caregiving, they often suffer from nutritional neglect and limited decision making power. This gender disadvantage affects not only their own health but also that of their children, thereby perpetuating a cycle of malnutrition and poor health across generations. Further, the interconnection between education, sanitation, and health also cannot be overlooked, because poor sanitation and unsafe drinking water contributes to disease burdens even today in the rural areas, which in turn undermine nutritional outcomes. Similarly, low levels of education, especially among women, limit awareness regarding balanced diets, hygiene, and healthcare utilization. Therefore, in conclusion, we can say that improving health and nutrition in rural India actually demands a kind of multidimensional and holistic and inclusive strategy. Strengthening healthcare infrastructure, ensuring effective implementation of the welfare schemes, promoting gender equality, and enhancing community awareness are all important components of this strategy, and all of these together can actually address the issue of poor health and nutrition condition in the rural areas. And therefore it is very, very crucial to address the underlying structural inequalities that exist in the rural areas, or that shapes the access to resources and opportunities in the rural areas. Because on one hand we have lower income levels, on the other hand we again have deep rooted social inequalities, and then poor health infrastructure, so on and so forth, and all of these together contributes to poor health outcomes in the rural areas. And only through sustained, inclusive, and context specific efforts can rural India achieve long term improvements in terms of health and nutritional well-being. So we hope you have understood what has been discussed in this video. With this, we have come to the end of today's discussion. Thank you.